Malawi is one of the world's poorest countries. The average life expectancy is 46 years, and the average adult earns around £100 per year. There is a chronic shortage of healthcare workers in Malawi. There are currently only 127 doctors to service a population of 14 million people. That compares to around 9,500 doctors in Scotland to treat a population of only 5 million. Lack of public health care means many people rely on voluntary organizations to provide the most basic of healthcare services. Charity Salima runs her own maternity clinic just outside the capital city, Lilongwe.
I decided to start this maternity clinic because I've stayed in this community for more than 10 years. And then at night, sometimes I could see women coming to my home, seeking for help. So I just thought that it was a calling that I should start something in the community here. Now, being a midwife who has retired, I just thought, why should I not start something which I know?
While public health services are free, the reality is that many people are forced to go to fee-paying clinics or rely on voluntary organizations. People often cannot reach public clinics as they live too far from their nearest clinic. For Malawians to receive anywhere near a decent standard of health care, more money needs to be spent on the health budget so that free public health care can be available to everyone. Rich countries have a role to play in making sure that this happens. They need to keep good the promises they made on aid, but what they also have to ensure is that aid is channeled directly into the health budgets. Then hopefully it will reach the people who need it most. We have just picked up Linda MacDonald, who is a Scottish midwife from Edinburgh. She has worked in Malawi for the last 6 months. Linda works with Malawian midwives and extended families who are left with babies after the mother dies in childbirth. I wanted to know from her what the differences were between working in Malawi and working in Scotland.
Well, the comparisons between the hospitals, the hospital I've worked in for many years and Bwaila government-run hospital here are huge. In fact, it's very difficult to compare. They are just not given any privacy in the ward. They all birth together in one room. There's curtains, but they're not always pulled. There's no, they're not asked how they're feeling. They are very suppressed. They never question. They accept. They accept whatever is given to them. So when they come through the door of Bwaila, the public hospital, they don't know whether they're going to go out alive, whether they're going to go out with a live baby. They have one shower between 16, 18 women. There is one toilet between them. The toilet can be blocked. The shower can be blocked. They've got no pillows. They've got no blankets. They have no pain relief sometimes. In fact, very seldom, very often, there's no pain relief to suture their tear after delivery, so they are being sutured without any pain relief. It is actually a hugely human rights issue as well. The women are not treated as individuals. So compared to home in Scotland and the UK, there's actually no comparison.
When given the chance, progress can be made. The government of Malawi and the international community has made progress around the issues of HIV by increasing the amount of people taking antiretroviral therapy for HIV. However, when people's immune systems are low, they catch other illnesses. They need and lack basic medicines. When there is the opportunity for aid to be channeled through national government budgets, it can work. In Malawi, the government and donors have doubled the intake of trainee nurses and doctors in the last 5 years and increased financial incentives to encourage them to stay in the public sector. This has had some successes. However, measures like this need to continue to be funded by the international community so that the health services in Malawi can continue to improve. Developing countries need the G8 to step up and deliver on aid commitments. When properly directed, aid works and it works well. Rich governments have made promises, that of 0.7% of their national income, that this would be given in aid. They should keep their promises. For a country like Malawi to get out of poverty, we need a healthy population. That can only be done when public health care is free and it reaches everyone.